Okay, so I checked the doctor's orders. The patient's vital signs, height and weight have been taken before this assessment. I'm gathering my equipment.
Come in.
Okay, I'm providing privacy. I'm providing the breaks. Hi, my name is Valerie. I am a student nurse from TSC, and today we will be performing a head-to-toe assessment, if that's okay with you.
Yes.
Okay, before we get started, would you like to go to the restroom?
No.
And would you prefer the assessment to be in English or in Spanish?
English.
Okay. Can I have your name and date of birth?
Esmeralda Soto, December 11th, 1999.
Okay, and do you know where you are?
Yes, the doctor's office.
Okay, and do you know what you're here for?
Head to toe.
Okay, and do you know what season we are in?
Spring.
Okay, and who drove you here?
Myself.
Okay. We are going to be asking you a series of questions, and if you could just answer those to the best of your knowledge. Do you suffer from any allergies?
No.
Do you suffer from any chronic diseases such as diabetes, hypertension?
No.
Any cancer?
No.
Do any of those chronic diseases run in your family?
No.
No kidney failure in your family?
No.
No. Okay. Do you do you have a history of falls, surgeries, or trauma?
No.
And do you do you smoke or chew tobacco?
No.
Do you drink excessive amounts of alcohol?
No.
Okay, so we're going to get started with your head assessment. We are looking for any infestations, any lesions, bumps, any signs of trauma to the head, any signs of alopecia, which I don't see any, and her hygiene seems to be pretty good. Okay, so do you suffer from any dizziness or constant headaches?
No.
Migraines? No? Okay, so then I am going to be feeling your temporal pulses here. Okay, and they are strong. Can you go ahead and open your mouth and close it? Okay, and I did not feel any or hear any crepitus sounds or grating in your temporomandibular joint. Do you wear any glasses?
Yes.
Okay, do you use them to see from far or from close?
From far.
Okay, and I am seeing that the sclera is white, her conjunctiva is nice and pink, there is no drainage to her eyes, and I am going to have you look at the wall behind me. Okay, and I'll look at my pen. Okay, just follow my pen without moving your head. Good. Keep following my pen without moving your head. Good. Okay, and I'm going to be turning off the lights. And I am going to be seeing if your pupils constrict and dilate as light reflects in them. Okay, so your pupils are equally rounded, reacted to light, and accommodated to accommodate. Okay, so now I will be looking at your nose. Your nose seems symmetrical to your face. It's in the middle. Okay, can you go ahead and look up for me? Okay, and I am looking to see if there is any polyps, ulcers. Have you suffered from any frequent nosebleeds? Okay, there is no swelling or redness to the nose. Her septum is not deviated. Can you go ahead and occlude one nostril? Breathe in and breathe out for me. Other side, breathe in and breathe out for me. Good, I am going to have you close your eyes and I am going to provide a smell for you. Just let me know what scent it is.
Alcohol.
Okay, good. Go ahead and open your eyes for me. Her lips look pink and moist. There is no sores or dryness to her mouth. Can you go ahead and open your mouth for me? I will be inspecting the inside of her mouth. Okay, go ahead and open your mouth for me. Stick out your tongue and wiggle it side to side. Stick it out for me and wiggle it side to side. Okay, her tongue seems to be nice and hydrated. There is no thrush noted. Can you go ahead and say ah, ah? Okay, and the uvula is nice and midlined. It rises as she says ah. Her gums seem to be in good conditions. They're not too dry. There is no cuts, lesions, or sores. Her teeth are intact. They are not cracked, or there is no cavities either. Can you go ahead and lift up your tongue? Okay, good. Can you go ahead and close your eyes for me real tight? Open them, smile, frown. Good. Can you puff out your cheeks for me? Good. I am going to be checking the sinuses. Do you feel any pain or tenderness?
No.
And the frontal sinuses. I am also going to be checking the characteristics of her ears and the skin integrity around them. Okay, I don't see no unusual drainage from the ears or bumps, nodules, or anything. Do you have any pain or tenderness?
No.
Okay, and I am going to be have you close one ear. Okay, and you're just going to repeat the 2 words that I say to you.
Brown dog.
Okay, and the other side.
Pink panda.
Okay, good. I am going to be having you close your eyes again, and I am going to be grabbing my little cotton ball. I'm going to be touching you, and you're just going to point to wherever you feel the cotton ball. So, go ahead. Good. Okay, and I am going to do a similar test, but this time you're going to tell me whenever you feel a sharp or whenever you feel a dull sensation, okay? And you're going to go do the same thing and point to where you feel it.
Sharp.
Okay,
Dull.
good.
Sharp.
Okay,
Dull.
okay,
Dull.
good.
Sharp.
Awesome.
Sharp.
Sorry about that.
Dull.
Good. And last one.
Sharp.
Okay. Good. You could go ahead and open your eyes now. Now I'm going to have you turn your face to the left, turn your face to the right. Look at me, up and down. Good. I am going to push against my hand, please. Good. And the other side. Awesome. So now I am going to be palpating the lymph nodes. So this is the preauricular node, the postauricular node, the occipital nodes, and I am just checking to see if they are inflamed or swollen. And this is the submandibular, sublingual, submental, down the jugular chain into the supraclavicular nodes, which I do not feel any abnormalities there. Do you have trouble swallowing, eating, or any discomfort as you eat?
No.
Have you noticed any trouble?
No.
Okay, so can you go ahead and look up? And I'm looking at her trachea. I'm looking at her trachea here, and it does seem to be midline. I don't notice any goiters. Just let me know if you feel any pain or tenderness. No? You don't feel any pain or tenderness anywhere?
No.
Okay, and I am going to have you take a sip of water, and I'm just going to see the way you swallow. Okay, and the trachea rises and falls as she drinks a sip of water. Okay, I am going to have you shrug your shoulders and let them fall. Okay, again with resistance. Good. Can you go ahead and flex your arms for me? Extend them. Flex them one more time. You're going to push against my hands. Good. Now pull against. There you go. And now extend your arms to the side. And if you can just put them to the back of your head, down, all the way to your back. And now we're going to do the same thing, only that forward, all the way to your back, and then all the way down to behind your back. Good. Go ahead and put them normal. I am going to be palpating your arms. Do you feel any pain or tenderness?
No.
No? Okay, and you haven't suffered from any joint pain or anything like that, right? No discomfort, no cracks or any type of crippling sounds?
No.
Okay, I am going to be looking at your jugular vein. So if you can turn your head, and I see no distension. Other side, no distension. I am also going to be palpating the carotid artery. Okay. Okay, and they're, it seems like a strong pulse. So I am also going to be auscultating the carotid artery with my bell. Okay, so breathe in, out, and hold. Thank you. The other side, that side, in, out, hold. Okay, and there is no bruise heard. Moving down to your lungs, I am going to be auscultating and just doing an overall assessment of your lungs, thorax, sounds. So can you go ahead and we're going to start with the back, so you can go ahead and put your legs to the side. Thank you. And I'm inspecting her posture. She has a pretty good posture. There's no slouching to one side or anything. So I'm going to ask you to bend forward for me. Okay, there's no signs of kyphosis, scoliosis. Can you go ahead and look up? And there's no signs of lordosis either. Do you feel any pain or tenderness?
No.
No? Nowhere here?
No.
Okay, let me know if you feel any pain.
No.
No?
No.
No? Can you take a deep breath for me? In and out. Good. Now I'm going to auscultate your lung sounds.
Mm-hmm.
Okay, so deep breath in and out, in and out. I would be listening to complete breath sounds of an inhalation and exhalation in each of these regions. So there is 10 spots that I would be hearing in the posterior thorax. Okay, can you go ahead and lift your arm? And since this is the right side, there is 3 parts to her lung, 3 lobes. So then I would listen to all 3 sounds. And on the left side, there is 2 lobes, so I would listen to both of those sounds. Okay, so now for the front of the thorax, I will be auscultating in a minute. I don't see her using accessory muscles, so then she already mentioned she has no trouble breathing, no signs of it either. Do you feel any pain or tenderness?
No.
Okay, I am going to be checking for the CVA, so go ahead and take a deep breath in and out. Okay, good. I am now going to be auscultating her lung sounds, starting at the top. So I take a deep breath in and out, and I would be listening to one complete breath sound. Okay, and there is 8 sides. Okay, and I did not hear any crackles, wheezes, or any abnormal sounds to her lungs. Okay, so moving on to her, have you had cardiac, heart? Have you had any trouble, any chest pain, any chest pain?
No.
Okay, I am going to be listening to the heart. So then from the clavicle, we'll go to the suprasternal notch, down to the point of Lewis, two intercostals to the right is the aortic. Okay, right across the sternum is the pulmonic Erb's point at the 3rd intercostal space, tricuspid at the 4th intercostal space, and the mitral valve at the 5th intercostal space and midclavicular. Okay, I would also be listening to the mitral propulsive maximal impulse for a whole minute. I am going to be checking her capillary refills. So they are less than 3 seconds. Okay, I am also going to be checking the pulses again. So then I would be checking the radial pulse, the ulnar, the brachial, the dorsal pedalis, the posterior tibia, and the popliteal. I would also inspect her femur pulse as she would be laying down. So go ahead and move on to the bed. I am going to be assessing the abdomen. Okay, and for the abdomen, I am going to raise the shirt and I am going to be inspecting the contour of the abdomen. I don't see no distension to her stomach, but if there was, I would measure it with a measuring tape. Okay, so I am. How are your bowel movements, ma'am?
Good. Once
Good.
a day.
Okay, do you have any trouble starting a stream or any trouble going to the restroom?
No.
I am listening to each quadrant for any bowel sounds. Okay, for 5 to 20 seconds each. I am also listening to the the epigastric point there. Okay, so then I am going to let me know if there is any. Let me know if you feel any pain or tenderness.
No.
Okay. Okay, and I would also percuss. Okay, noting for any tympanic sounds, which is normal. Okay. Now I am palpating the hips. Do you feel any pain or tenderness? Any pain or tenderness?
No.
Okay, and going down to the genitalia, I would ask her if she is sexually active and if she experiences, if she's with multiple persons. I would explain the signs and symptoms for HIV. I would also place her in a dorsal recumbent position since she is a female. I would inspect the perineal area and then retract the labia majora. I am looking to see if there is any lacerations, any abnormal bleedings. I would also ask her when was her last menstrual period. I would check if there is any discharge, and if there was, I would get a culture for it. I would move on to the rectum area, and I would be assessing for any tears, any hemorrhoids, lacerations, the redness, swelling, anything like that as well. Okay, I am now going to be performing the range of motion for the lower extremities. So I would grab her leg, okay, to the outside, in, down, okay, to the side, and out, okay, back down. I would be checking the capillary refills on her toes as well. Go ahead and point, flex, inversion, eversion, toes, okay, all around. And I would do this bilaterally. I would also be doing the get up and go. So go ahead and come here. I'm gonna help you up here. So this test, it requires you to sit down, and we are going to sit on this chair and stand up, walk a couple steps. You're not going to use any assistance of the chair. You're just going to try to get up by yourself. I'll hold the chair for you. Okay, so go ahead and go. Okay, and go ahead and walk, turn around, come in, and sit down. Good. And now we are going to perform the Romberg's test. So if you can please stand up for me. Okay, and just put your hands down to the side. Go ahead and close your eyes. Okay, and in this test we're seeing for minimum or no swaying of her body, which I noticed a little swaying, but that's okay because that is normal. Okay, so go ahead and sit back down. And this concludes our head to toe assessment. Do you have any questions for me?
No.
Okay, so I will go ahead and go and document. You can go ahead and change back into your normal clothes, and we'll be right back with you.
All right, thank you.
Thank you.